Welcome back to Ronnie, I'm Joe B. Are you considering to undergo a right medial meniscal repair? Do you want to know what happens during the surgical procedure? If so, then let's dive in. For medial meniscus repair, the patient was brought to the operating room, placed supine on the operating table, and administered adequate anesthesia. A timeout procedure was conducted to confirm patient identity, surgical site, and procedure. The right lower extremity was prepped and draped in a sterile fashion. A standard arthroscopic approach was employed. A 4mm arthroscope was introduced into the right knee through a medial portal. Initial inspection revealed a longitudinal tear involving the posterior horn of the medial meniscus, extending approximately 1.5 centimeters. The torn edges of the meniscus were carefully debrided using arthroscopic shavers and graspers to create a stable, well-vascularized margin for repair. The tear site was thoroughly prepared by removing fibrillated tissue and creating a bleeding, bony bed to promote healing. 2 horizontal mattress sutures using non-absorbable braided sutures were placed through the meniscal tissue adjacent to the tear. Suture placement was performed under direct arthroscopic visualization to ensure accurate positioning and adequate tissue purchase. Each suture was tied securely using arthroscopic knot tying techniques to approximate the torn edges of the meniscus and achieve stable fixation. The repaired meniscus was inspected under arthroscopic visualization to confirm proper apposition of the tear edges and adequate tension on the sutures. Range of motion of the knee was assessed to ensure no impingement or limitation. So do you want to know what happens during a total knee replacement surgery? If so, then watch this next video. Thank you so much.